All right, tricky step one question. A 20-year-old woman comes to the gynecology for evaluation of abdominal cervical cytology. She has no significant past medical history and is sexually active with 2 males. She is given a vaccine, a quadrivalent HPV vaccine at 18. Pap testing shows high-grade squamous epithelial lesion. And so we're thinking HPV progression to cervical cancer, and there's an overexpression of the P16 protein. So before we dive into this one, which is a challenging question, let's talk about the basic concept. So HPV can infect the cervical epithelial cells and cause dysplasia, disorganized growth, which leads to cervical intraepithelial neoplasms. And the low grade means the dysplasia is confined just to like the lower 1/3 of the cervical epithelium. And in most cases, it'll just regress spontaneously. A high grade cervical intraepithelial lesion, like a 2 or a 3, means there's dysplastic epithelial growth that is advanced beyond the border of the lower 1/3. And so the epithelium has an extension toward the epithelial surface, because you got your normal cervix, which has the squamous epithelium. It's all great. And then you have the less than 1/3 of the epithelium, and then it's greater than 1/3 of the epithelium for high grade. And so high grade is at really big risk for invasive carcinomas. So basement membrane invasion is a huge finding that describes the extension of the atypical cells below the epithelium, and that'd be consistent with invasive cervical cancer. But let's talk about some of our answer choices here. So we know that HPV works. There are high-risk types. There's 16 and there's 18. We'll write this down here. So we have HPV 16 and then we have 18. And they produce oncoproteins. And there's E6, and that binds and degrades P53. And then there's our E7, binds and degrades our RB, retinoblastoma protein. So E7 is with retinoblastoma. And RB normally inhibits the cell by sequestering, so E7 or RB inhibits the cell cycle and by sequestering E2F, which is a transcription factor that drives the G1 to the S phase. And so it inhibits that. Retinoblastoma does that. Between G1 and S, you need to know that. Okay, and when E7 inactivates RB, then E2F is released and it causes uncontrolled cell division. And P16 is a cyclin-dependent kinase inhibitor that accumulates in response to this loss, the RB loss. So that's what P16 does. So P16 overexpression is a marker for high-risk HPV infections. And so it's going to be the overexpression of the E7 that leads to this degradation pathway. Because if you overexpress E7, it'll bind and degrade RB. And RB normally inhibits the E2F by sequestering the E2F. And so when E7 is inactivated, or when E7 inactivates RB, then E2F is released, and that causes uncontrolled cell division, which is happening in this patient's condition. So that uncontrolled cell division is caused by E2F release, and that's because the E7 inactivates RB. And RB normally inhibits this, but our E7 is like, hey, RB, don't do your job anymore. And now it's just rapid proliferation. And so that's this whole cycle. That's how it all works. So really complicated question, but it gets at the main point here. So this person is CIN3 full thickness dysplasia, basement membrane is intact, high risk HPV. And yeah, that's the mechanism. So A, inhibition of telomerase by P53. So that's not relevant. P53 is inhibited, not activated, right? Because E6 binds and degrades 53 by E6, which is a high-risk HPV type. So HPV 16 and 18 make the oncogenes. E6 is one of them. It binds and degrades P53. And so, yeah, that doesn't even make sense. It's irrelevant. C, hyperphosphorylation of P53. That's not how it's inactivated. So no. Cholelicitic change due to HPV's low-risk subtype. Low-risk types like 6 and 11 cause warts. So, yeah, they wouldn't cause CIN. Inactivation of DNA methylation by the E6. E6 targets P53, not methylation. So that's not the right answer. Okay, really hard question, but if you followed, then you know a lot about HPV, E6, E7, E7's effect on RB, the degradation of retinoblastoma, the protein, and that inhibiting E2F, causing the proliferation, because the G1 to S phase is going to go rapid now because you don't have that RB there. So hopefully that was helpful. We'll see you in the next video.